Hello all. Welcome to my channel Mastering Meds. In this video, we'll learn about drug-receptor interactions. Before moving forward, let's recall what receptor is. So a receptor is defined as specialized proteins located on or inside the effector cell that identifies the response to it. When drug binds to specific receptor, it can inactivate a receptor. The different types of drug interaction are agonist and antagonist. Before moving on to what agonist and antagonist is, let's see the classification. Agonists are of three types: full agonist, partial agonist and inverse agonist. Likewise, antagonists are of two types: competitive and non-competitive antagonists. Whereas the competitive antagonism happens by two ways: reversible and irreversible. Let's learn each one of this what they are with examples. Now starting with agonist. These are the agents or drugs that binds to receptor to produce similar physiologic effect. The point to remember here is it causes the same action as the substance that normally binds to the receptor. Now you may wonder what full agonist do. Full agonist. These are the agents or drugs that binds to receptor to produce full physiologic effects. That means they produce maximal effects. Example, morphine, an opioid agonist that produce analgesia. The next type of agonist is partial agonist. These are the drugs or agents that bind to receptor to produce submaximal effects. Example, buprenorphine, binds to mu-opioid receptor, used for pain management. For a better understanding, buprenorphine partially activates the mu-opioid receptors, providing a ceiling effect where higher doses do not produce a proportional increase in effect like a full agonist. Last but not the least comes the inverse agonist. These are the agents or drugs that bind to receptor to produce an effect in the opposite direction to that of the agonist. Example, clozapine, considered an inverse agonist at serotonin 5-HT2A receptors. It means that clozapine's inverse agonism means it has an opposite effect to that of serotonin at this particular receptor, but it does so by stabilizing the inactive form rather than blocking the active one. This action is a key part of its efficacy in treating psychosis, as seen in the link between 5-HT2A inverse agonism and a reduction in symptoms like hallucinations and delusions. This type of drug-receptor interaction is antagonist. These are the agents or drugs that bind to receptor but do not activate them and block the action of an agonist on the receptor. Antagonists consists of competitive and non-competitive. Competitive antagonists. It is of two types: reversible and irreversible antagonism. Reversible antagonism, when antagonist bind to receptor at same site as that of agonist non-covalently such that the action of agonist is blocked. Example, acetylcholine, agonist. Atropine, antagonist. They both compete for cholinergic receptors. Moving on to irreversible antagonists. When antagonist binds to receptor at same site as that of agonist covalently such that it produces irreversible blocking. Example, phenoxybenzamine is an antagonist that competes for the active site and binds covalently, thereby blocks vasoconstriction, causing blood pressure to fall. Last but not the least is non-competitive antagonist, when antagonist binds to receptor other than its binding site. Example, ketamine is an antagonist of NMDA receptor. It exerts its anesthetic and analgesic effect.